Hi, Mike McGuigan here from the Sports Performance Research Institute in New Zealand.
In this video, we discuss some of our research on the use of isometric testing to assess athletes. Recently, there has been a resurgence in the use of isometric assessments in strength and conditioning. Isometric, or static contractions, are characterized by muscle actions which result in no change in the joint angle. Isometric tests are typically performed to quantify an athlete's maximal force production as well as rate of force development. Both of these factors are thought to be critical components of successful athletic performance. Isometric tests have also been shown to result in minimal fatigue, use relatively inexpensive equipment, and carry a low risk of injury, even in populations with no previous resistance training history. The isometric mid-thigh pull, along with the isometric squat, are common isometric tests that are used for athletic assessment. The best position is likely to be the joint angle at which peak force is developed in that exercise of interest. For the mid-thigh pull, this is where the hip angle and knee angles are approximately 155 to 165 degrees and 125 to 135 degrees respectively. The athlete stands on a force plate and pulls with maximum effort against a fixed bar for 3 to 5 seconds. In a series of studies, we have compared the peak force produced during an isometric mid-thigh pull with dynamic exercises such as 1 repetition maximum squats and power cleans, as well as movements like counter-movement jumps and static jumps. The results have shown high correlations between isometric and dynamic performance across a wide range of athlete populations. This includes sports such as rugby union, football, and rowing. We've also shown that peak force obtained in the isometric mid-thigh pull test is very reliable. When testing large groups of athletes, strength and conditioning coaches can use isometric tests such as the mid-thigh pull and be confident that this type of testing is giving a valid and reliable indication of the strength level of their athletes. Isometric assessment and training could also be performed unilaterally to investigate and train deficits. By comparing the maximum force produced during the isometric task with a dynamic movement such as a jump squat, the strength and conditioning coach can obtain information about the athlete's dynamic strength deficit. For example, a low ratio of dynamic force relative to isometric force could indicate that the athlete requires more ballistic training, and their training could incorporate more exercises such as loaded and unloaded jump squats. Isometric assessment can potentially add great value to the overall strength profile of athletes.